Mike Wiseman. I'm the CEO of Trauma Services. We're the leading provider in biohazardous remediation as well as infectious disease cleaning in all of New England. Obviously, we're all following the coronavirus, all the updates. Every day there's new information coming out about the virus. Being an infectious disease company, we've handled infectious diseases for roughly the past 30 years. So we have an actual 16-page protocol that we put together from a lot of the other virus cleanups that we've done over the years and infectious disease cleanups. Would love to give that to anybody who's looking for information. One of the misconceptions I just want to make sure you realize is that you just shouldn't have any janitorial or regular cleaning company go in and take care of this. It's okay if you're doing preliminary cleaning, but once you have a confirmed case, you really need a professional to make sure that your facility is cleaned properly. All of our employees are trained the exact same way. Whether we do something today or we do it in 100 days, it's all done the same way. It's a very detailed 3-step cleaning process with 2 different chemicals to make sure that it is cleaned and killed properly. There's definitely a couple of things you can do to help yourself and help your family out to stay safe during this time. Make sure you wash your hands consistently. 20 seconds is the time frame that people say that you have to wash your hands. I find it easier when we teach classes that we tell you to sing happy birthday in your head because that lasts 20 to 30 seconds. It also takes your mind off it because you actually think about how long you're washing your hands. It seems like it's a lot longer than it is, but you have to do it for 20 seconds. So in order to catch the coronavirus, it has to enter a mucous membrane. So you have to protect your ears, eyes, nose, throat. You definitely want to make sure you do is don't touch your face, but please keep your hands away from your face. That is the one way, even if you have the virus on your hand, it can't enter your fingertips unless you have a cut. It has to enter through a mucous membrane. I'd like to end lastly, so if you do have a confirmed case of the coronavirus, make sure you call a professional to take care of it. Every hard surface, every area that person has come in contact with, you should consider infectious. It must be cleaned by a professional company. Here at Trauma Services, we have a proven track record, and we actually have a protocol in place that works for infectious disease. Give us a call. We can walk you through our protocol, how we're going to take care of it for you, and how we're going to bring that environment back to a safe and inhabitable space.